Hello everyone, I'm Dr. CIMMY Augustine from the Department of Prosthodontics, Mahi Institute of Dental Sciences and Hospital. Today's topic of discussion is obturators. So what is maxillofacial prosthodontics? It is a branch of prosthodontics which is concerned with the restoration and replacement of stomatognathtic and craniofacial structures with prostheses that may or may not be removed on a regular or elective basis. So the objectives of a maxillofacial prosthetics is to restore aesthetics or the cosmetic appearance of a patient, to restore the function, to protect the tissues, to provide a therapeutic or a healing effect, and psychological therapy. So what is an obturator? As we have already learned about the defects, various maxillofacial defects are there. Okay, it could all be caused because of acquired defects, or it could be congenital defects. So the acquired defects were because of either the patient has undergone a total maxillectomy or a partial maxillectomy. The congenital defects were because of cleft lip or cleft palate. Okay. So in order to cover up those defects, we give something as an obturator. So what is an obturator? It is a maxillofacial prosthesis which is used to close a congenital or an acquired tissue opening, primarily of the hard palate and or a contiguous alveolar soft tissue structures. It can also be defined as that component of a prosthesis that fits into and closes a defect within the oral cavity or other defects. These are the GPT-9 definitions of obturators. Now, what are the advantages of an obturator? Why do we need to give an obturator? It will help to close, cover, and maintain the integrity of the oral and the nasal cavities. It will facilitate speech and deglutition by replacing those tissues which are lost because of the disease process, and can, as a result, reduce nasal regurgitation and hypernasal speech. It will help to improve the articulation, deglutition, and mastication. As you all can imagine, see, it is a defect, a maxillary defect is there. So when the patient tries to speak, because there's a defect, patient will not be able to speak clearly, and whatever patient is eating, that will go into the nasal cavity. Okay, so mainly the speech and the deglutition is affected. So in all these cases, it is an obturator which covers up this defect and helps in the maintenance of the normal functions of the oral and the nasal cavity. Now, depending on the phases of treatment, obturators are divided into surgical obturators, interim obturators, or definitive obturators. And depending upon the material which is used for the fabrication, it can either be a metal obturator, it can be an obturator which is made of silicone, or it can be a resin obturator. Now, depending upon the area of restoration, it can be either a palatal obturator or it can be an obturator of the meatus. Now, what is a surgical obturator? According to GPT-9 definition, it is a temporary maxillofacial prosthesis which is inserted during or immediately following surgical or traumatic loss of a portion or all of one or both maxilla and contiguous oral structures. So it is basically a base plate type of lens which is constructed from the pre-operative impression cast, and it is inserted at the time of section of the maxilla operating room. So this is a patient who was planned for surgery. So before the resection is done, we make an impression. So that is known as the pre-surgical impression. So from that we get a pre-surgical cast and give it to the surgeon. Surgeon marks the area in which they are to do the resection. So once that is done, then we trim all teeth that area. So is the area in which they were their defect is here, and the portion which is made of plaster, that portion is where they are set. So all the trim, all the and some reduction. So reduction also has to be done. Then the obturator. This obturator is made using clear X, and this is inserted in patient's mouth post-operative soon after surgery. So what is an objective making this obturator? It helps to maintain the packing of the relationship, thus ensuring close adaptation of the skin. That means the area where the defect was there, defect is removed and is surgically packed, and a skin graft is placed there and surgically packed. So this obturator is to maintain that pack, thus ensuring close adaptation of the skin graft. Then it reduces oral contamination of the during immediate post-surgical period and may reduce the incidence of local infection, which is discounted. Therefore, it is reducing the contamination and reducing the incidence of local infection. It permits deglutation, thus eliminating the gastric tube because it is closing the defect, so the patient may not need a nasal tube, and patients would enables the patient to sleep actively immediately stop by producing normal values and positive discomfort. It's like a valve, valve something. Therefore, it is the patient to sleep effectively. It lessens the psychological impact of surgery by making relative aware. So that it is as soon as surgery. Patient is assured that has some patients they can be discharged in 5 days surgery. Now, coming to second type of obturator is interim obturator. So, an interim obturator superficial process which is made following of initial from the surgical section or one. So, this process is surgical obturator. Therefore, even though the margins are clearly defined and surgically we are not further for the surgical effect is not, but because the difference is healing, even that is called as obturator versus non. So this will save string before a definitive obturator is made. So an interim obturator is made after the initial healing starts. So what are the objectives of objective is to construct of surgery. So surgical obturator was constructed to surgical patients. So after initial healing is done, and pressure surgical patients. That fabrication and first the place. So the patient has to be seen every 2 weeks. So the wrap tissue changes that occurs with a defect, and healing. So we will have this process. This process is establish the option of access. Surgical obturator to have and with this thing. That's right. Whereas when some things. So extractive or the trade side, we may provide processes to the cases that sweat processes to serve as a backup when definitely has to add action or just temperature. This temperature is given healing. The reaction is actually like see the first bit is just a surgical curator start palette. Second option as is the start. Further we have done and is curator definite. So what is a definition? In order to find the definition, isolation processes is all of one of an associated pattern. As a result of surgery trauma, if curator is made, then tissue changes or fragments of a tube untied and a motion can achieve when tumors and we are not expecting much tissue change to that time. Definitely. So check it. That is not surgery site at time to be stable and patient is prepared and emotional for the rest of the care. So this is stated and site dimension stable and patient is prepared. So as we all changes will take changes with respect to healing and that will to one. So, but this depends on the size of the progress of timing surgical action. So all these factors will determine which time it will take. So that time comes it will definitely. So this obturator, first it is definitive and as always this obturator will extend this have to enhance its retention, support, step. Processes as it is extending to a defect, it may have a hollow bulb or it will have a hollow bulb which has a closed portion instead of a free aquatic processes. If we have give aquatic processes, the weight of the processes will be too much. Already the area is effective, so it will not be able to hold that much weight of the processor. So in order to reduce the weight, we give a hollow bulb processor. Studies have shown that a hollow bulb processors can reduce the weight of the processor by 7 to 43%. Then it could have a metal framework or a resin base, which can act as a pallet and support teeth and the closed bulb, which is hollow. So it can have a metal framework or it as we all know, it should be simple, it should be lightweight, and it should be easy to adjust. So this is a patient had surgical defect, and after the has taken place, then our definitive actuator. So what are the various steps in the actuator? First step is diagnosis and treatment. You determine the size, the extent, location. Then once we have preliminary action is taken, just to record under. So usually for the surgical actuator, they take two impressions. One is to keep it as a record. Second is to make the surgical actuator. So once patient surgical obturator, the interim obturator, and the patient is obturator. First thing that must be make a preliminary impression. From that, we take and fabric system tray and for the molding of that. And patient is asked to experiment with it. And that is then find and it is cross checked asking the patient swallowing and head sideways. Let's see if the patient has some mistake. So once that is done, we obtain the final position. Then get a master cast and how see this it will follow. Means we start jaw relation and jaw relation is done and then arrange setting and insertion process is done. So this is all today. Thank you.